today's session. So without further ado, I would like to welcome our guest speaker, Dr. Nuhu. I hope I pronounced your name right. And I'll just read bio. Yeah. So Dr. Nuhu graduated with Doctor of Veterinary Medicine from the University Putra, Malaysia in 2007 before an MVSc in Veterinary Epidemiology and Economics from Utrecht University in 2010. She furthered her studies at the University of and final year undergraduate students in the DVM program. She's also the coordinator of the Veterinary Public Health Laboratory and an approved signatory for the veterinary bacteriology laboratory. She's three postgraduate students and she's a member of this three PhD students and four master workforce students today. And I would hand it over to her. Hello, Dr. Miro.
Hi,
Thank
Mariam.
you.
Thank you so much, Mariam. Okay, thank you so much. Again, I would like to say thank you to all of you for, especially organizers, Ms. Waibatul and team, for inviting me and for being able to spend your day, your night, your morning, your late evening, wherever you are across the globe. I truly appreciate that. And yeah, so without further ado, I'm just going to start presenting my slides. Okay, I'll bring on my slides. Okay. Okay, it may take a while. Again. So I hope all of you are doing well. While my slides are uploading, it shall reach there. But yeah, hopefully, yeah. So in the meantime, I hope all of you are keeping safe because I'm back in where I am right now. The number of cases of COVID-19 is rising up high. And mainly it's attributed to the Omicron variant and also to the school holidays, public holidays that has been happening for the past 2 weeks. So many gatherings had happened during those time, and yeah, and presumably that caused a rise in cases. So hopefully things will be still under control because of the vaccine program. All right, so there it is. Could you see it, Swaibatul or Mariam? Is it in presenter mode right now? I mean,
yes, doctor, you can see it.
thank you so much. All right. Okay, so I'll start. So today's topic, in conjunction with the celebration of the One Health Awareness Month and also the webinar series that IVSA, the subcommittee for One Health, is arranging for yesterday and also today, I would like to share one topic that is quite close to my heart. So basically, it's the One Health Empowerment Among Future Workforce. And I am based as a lecturer, as Mariam had introduced me, at University Putra Malaysia. And also, I am part of the National Coordinating Office for Malaysia One Health University Network, or also MyHun. Okay, and all right. So because IVSA, I mean, with veterinary students, they're very close to my heart because I used to be one of you guys. And I mean, taking back down memory lane, back in September 2002, I started to register as a veterinary student at the Faculty of Veterinary Medicine, University Putra Malaysia. And of all the things that kind of like triggered me as to why I wanted to be a vet was this particular old series from the Animal Planet channel. So it was called the Emergency Vets. And I thought at that time it was like really cool to be helping those furry friends, cats, dogs, and I really love. I've got a few of cats on my own, and I was like, oh yeah, it's cool to become vets. So definitely this was one of the inspiring series that kind of like pushed me to go into vet school. And 2002, 2022, that was 20 years ago. So I feel very, very, very old as compared to the rest of you today. So that was quite like 2 decades ago. But I'm not sure, like, in year 2002, probably it was the year that you guys were born. So I'm not sure on that, but probably yes, because I think that is quite around your age. However, like in my study years at that particular phase or years, people are talking about Y2K, and the computer looked a bit like this mainly. And you can see like these TV series were like the cool drama series that we watched, after class to chill back. So I mean, I think Grey's Anatomy and Supernatural might still be running or already like ended in their final episode. So we have Gilmore Girls and also The Amazing Race. So these are kind of like bringing back to the past 2 decades when I started my journey. So when we talk about that era, in terms of sharing or talking about infectious diseases, about pandemic, it's not really something that is, that we hear as much as nowadays. So especially even more so as we are living in the COVID-19 pandemic, every single day it's on the news, it's on social media. But back in 20 years back, I mean, we only read it through newspapers. There wasn't even Facebook or Twitter or Instagram. It wasn't established at that point of time. It was only Friendster and MySpace. So, and also the old interface of Yahoo. So, I mean, there's no such thing as, oh, just Google it. It wasn't established yet, so it wasn't available at that point in time. So, when we listen to lectures, mainly, for example, at that particular moment, it was between 2002, 2003, we had the first severe acute respiratory syndrome outbreak happening between 2002 to 2003 in China. And then we also have the H5N1 avian flu that was also being reported in the news media. So it's only then our lecturers started to sort of like introduce these diseases and the term of epidemic. I mean, of course, you do learn it through epidemiology, through public health courses, but I mean, they start to kind of like bring in these kind of like what's in the news kind of thing that you can then relate to your the theoretical part in the lecture. But that one, I think that was it. And then mainly our lives revolves around lecture halls, libraries. If we happen to go, we always I think go to these to the library whenever we are facing examinations. I think like during the study week, the library will be jam packed, and then there's also like group discussion. And then at that point of time, we were only beginning with the student-centered learning, problem-based learning, case-based learning, that kind of activities. But it was just very introductory phase. And this was what I said when said the Yahoo interface. So it's really like basic and very unattractive. So these were the kind of like resources that we had to rely on when we were learning. And then, so in terms of, again, like diseases, what we kind of like registered in our head was, apart from memorizing the lecture notes, as what most of us do when during our student stays And I mean, if you happen to have that extra effort of reading outside, you can go to the library. You can read journal articles if you do have access to it. Otherwise, it's through learning experiences, it's through practical classes. So what I remember vividly was the experience of me being part of the H5N1 team somewhere in my country. So the students were also like mobilized to certain states with H5N1 outbreak among chickens. So these were chickens that were smuggled from the Thai border and Malaysian border. So they were smuggled into our country, and then basically it caused like a few outbreaks in certain villages. And so when that happened, the veterinary services department needed more people to work with, and then they invited the vet students because we were able to do the cloacal swab from these chickens and birds. So we were mobilized to that. And then that kind of like, oh, like this is what is happening in the field. Before this, yes, we may be learning about treatment, control, preventive measures in class, but when you go outside, then you would be able to see that, oh my God, I mean, it's much more. In reality, I mean, later on when I go into the working world, it's going to be more than whatever that has been taught in the class, in the textbooks, in the lecture slides. It's all the other skills that you have never kind of like imagined that you need there, and then you then say that, oh, I need to be able to speak to people from other departments. I need to be able to speak people who are way more senior than I am at that point of time. I need to be competent in doing even just the simplest colical swab that people would say like, oh, it's just colical swab. But at that moment, at times when you are wearing all of these PPEs, you oftentimes can get it wrong, you know, because of the birds are not cooperating. Sometimes you have to sample from the geese as well, and you would imagine their wings flapping all together. And then it was also post flooding, so we had to crawl underneath the houses and whatnot. So these all experiences, it really sticks to my head, I mean, up until now. And then the rest were just normal visits to the abattoir, following vaccination programs for FMD among buffaloes, and also ringworms, because we have classmates who had contracted ringworm from the animals or patients from the hospitals during rotation in final year. So these are the kind of learning experiences that we had during those times. And how about One Health? It was never mentioned actually between 2002 to 2007. So was it that I was becoming like very ignorant about what other students were studying? I mean, was it about being antisocial, not being mixed with other students? Was it because due to the restriction in schedule, we are sort of like thrown into like a silo, and then you would only see your friends from other courses when you graduate in the graduation hall? So was that, I mean, are these the reasons why I've never heard about One Health before? Well, we do see nowadays that the disparity between sort of like my generation and also the newer generation, as in all of you right now. So after 2000 and maybe 10 and above, most of you would have at least heard about One Health, the term of One Health, or have at least been trained in certain lectures or seminars, workshops about One Health, or because One Health is already embedded in the revised, renewed curriculum. So for my generation, sort of like One Health was never mentioned, and so it's actually something new to those who are actually already in service as compared to the future workforce. Why is it so? And so it goes back to actually the timeline of whereby all of these recent or happenings of epidemics of disease outbreaks that affects mainly more than one country at the same time. So we've got bird flu, we've also got SARS. So in 2003, WHO sort of like started the Global Outbreak Alert and Response Network to coordinate research by teams of the international experts. And so in 2005, 2 years later, they also revised their international health regulations, and with the new rules aiming to boost collective defenses against global health challenges and improve preparedness and response. And it was coming into full force in June 2007, whereby the WHO requires member states to notify them of potential global health emergencies, which is actually listed as well on the WHO website. And what I have already shared with you before was the timeline that was actually before all of these happened. And of course, 2003 and 2005 was within the years where I was studying, but there's no way at that time that there were changes introduced into the curriculum that would allow introduction of the term of One Health concept during my years. And so I think for example, as we all know, tsunami happened back in 2004. And if this was something that happened today, of course, people would be bringing into climate change issue about food security. So it goes beyond just infectious diseases. People are looking at from a One Health point of view rather than okay, you're saving lives. Yes, you have to recover back and all of that. But the scope of discussion, at least in 2004, wasn't much from my point of view as a vet student. It wasn't mentioned at all. To discuss about the implications of any infectious diseases after that happened, what can happen, what happens to the animal, what happens to the food animal livestock industry, what kind of like zoonotic diseases that could happen after that, so that kind of like discussion aspects did not happen during my time, and that was because they didn't actually introduce or made One Health quite a thing. But after that, as I mentioned before, WHO started to initiate the GORN, okay, and then from there on, we were able to see as to what is already happening right now with all the One Health initiatives. And also at the same time with social media going on, people are beginning to be more aware of what is happening around, deforestation, smuggling, poaching. So these kind of things are being brought up, and this is very, very, very good because we need to keep the awareness going. It's not just to introduce one time, but also to keep making a noise about it, and at the same time trying to act so that at least if it's just a tiny bit part of it, it would definitely help in the long run. And this is basically the heat maps of predictive relative risk distribution. So basically the highlighted areas are the areas whereby there is predicted to be higher chances of emerging infectious diseases outbreak to occur. So you see like kind of like the hotspot over here within the Asian region, specifically within the Central and Southeast Asia part. So this was from a paper by Allen et al. In 2017. So, and also we are seeing as well in Forbes, they published this map indicating countries which are the best and worst prepared for an epidemic. So they ranked from the best to worst as in different colors based on their statistics that they have mentioned before. And then so we are seeing this as it's kind of like, you see like it's sometimes it's too much to handle. You've got climate change, you've got at the same time that we are seeing here population growth, urbanization, deforestation, uncontrolled logging activities, agricultural and land use, while animal trafficking, healthcare and sanitation issues in certain areas, and then also the social aspect of it, cultures and beliefs, for example, refusing to vaccines, infodemic, is it false information, is it good, correct information, people who are outside of the medical world, for example, they may not understand fully the benefits or the basics of immunology vaccine. So hence they might be coming up or believing those anti-vaccination propaganda that we are seeing right now. Okay, and then barriers to effective communication between policymakers and also public political barriers as well, conflict of interest between those in power and also those who are actually on the ground doing the work. Maybe the message has been conveyed by those working on the ground, but for some reason, it's not of interest to those in power. So, how do those on the ground would want to help to solve it, if those in power are not trying to help or understanding the importance of, trying to solve those issues. And so this goes back to this point here, interest and priority of the stakeholders or decision and policymakers. So it seems so messed up. And it's not even for future One Health workforce. It's also that we are already, those in service are actually experiencing right now. And so these are all seen as wicked problems, as people, you might have heard this term before, like, oh, One Health are wicked problems, because it cannot simply be resolved by just one ministry, by just one person, by just one group. So a wise mind never knows all, only fools know everything. And this is actually a very accurate observation of what has been happening around. So because nobody is superior, inferior, with all these hierarchy and bureaucracies putting in barriers in terms of effective resolve or steps that is needed to be in place to resolve an issue. Okay, so which is why we have One Health, and I'm pretty sure all of you are very much aware on the updated definition of One Health by the Joint Tripartite and also from the United Nations Environmental Program statement. Okay, so they added certain elements to make it more comprehensive, and basically it specifies here the health of humans, domestic and wild animals, plants, and also the wider environment, including ecosystems, are closely interdependent. Okay, so we have to be able to appreciate the importance of those working out of the normal triage, okay, normal Venn diagram of human health, animal health, and environmental health, but to incorporate as well those who are not normally seen to be helping out in terms of health issues. Okay, all right, so, and it's time to act, as we all know. And part of it, as some of you might heard, is from the USAID, One Health Workforce Next Generation. So they've got two chapters. One is within the African continent. They have the AfroHUN, and also within the Southeast Asia One Health University Network within the Southeast Asia region. Okay, and this is part of where my HUN also lies in, and so we do have lots of activities, but mainly it's to develop resilient and competent One Health workforce by leveraging education, research, and training excellence to its future and also in-service workforce. And so how do we make sure that all of you, the future One Health workforce, would be well equipped to face all of these One Health challenges? So we have to make sure that we include the elements of the necessary skills, knowledge, and also behaviors that is required in order to be able to work together in One Health approach later on. So we need to incorporate these so-called core competencies. And I mean, there's so many, I think, bodies who are trying to develop the One Health core competencies right now, because they realize that it's very important. And this is only the example from the Southeast Asia One Health University Network set of core competencies. And as you can see here, on the left side, okay, my left side, it's more of the technical knowledge, the ones that you get in lectures, One Health concepts knowledge, fundamentals of infectious diseases, epidemiology, okay? And then on the right side of it is kind of like So on the left, I will always say like it's like the brain part of it, and on the right side, it's more of the empathic, the heart of it, the soft skills that is ideally each and every one of us would be able to have or would be able to be exposed to in order to work together in an effective One Health approach later on. And these One Health core competencies can be delivered in many forms. And part of it, as we call One Health training, it can be in the form of courses, tutorials delivered by your universities, field experiences, workshops, seminars, student clubs activities, or even associations as we are having right now, and also simulation exercise. And basically, it's to ensure that all of you are well equipped and well trained to face the challenges later on when you are working. So it's trying to prime you guys, from beginner, moving on slowly to become intermediate, and then advanced and also expert level. So basically, we're trying to start early, okay? So at least at this point of stage. And for the next few slides, I am going to be sharing with you the kind of activities that particularly that I've been part of, which involves training and empowering the students. And as you can see here, this is an activity that happened in one of the forests in Peninsular Malaysia. So it's in Royal Balom Forest, and it's one of the oldest forests in the world. And we have indigenous people communities living over there. So these communities are very much are living remotely from us. I mean, in order to reach those villages, it takes like a few hours on speedboat. And so we had to stay overnight on houseboat, as what you can see over here, that the students are trying to like open their eyes and listening to the discussion session. So, um, so One Health approach is seen through this activity whereby the head of a program, Prof. Rashid, thinks that it's really good to train not only the students but at the same time lecturers. So we have a few lecturers also coming in from the vet school, medical school, environmental health school. We did invite a few from the forestry and environmental school, but they weren't being able to join. But they did send in their students. So there's a good mixture of One Health related students from One Health related fields. And the objective of this program was to train, apart from the students, the university students, but also to be going to the communities, indigenous Orang Asli communities in those villages to empower them about, it was on COVID-19 at that time. So which is why we wore masks, because it was still ongoing, okay? And then we went to the schools, and then this is where we went to, and then part of the team had to go on four-wheel drives, and then we were trying to teach or trying to share information about COVID-19, and trying to make them avoid misunderstanding or vilifying certain wild animals around them, for example, so that they are able to understand that these animals are not actually the problem. It's just that how we, have to keep up the balance, proximity between wild animals. What can we do? What can we not do? Food handling, and actually how actually COVID-19 has been transmitted. Okay, so mainly on that, and also the basic concepts on germs. As over here, some of you might know this glow germ activity kit box that we brought to the school. And the students were also being taught about other preventive measures mainly, and then they were very very excited and happy to see students or people coming into their communities, because that doesn't happen often. And then at the same time, it's not only a one-way kind of like learning experience, because we also learn their local dialects, certain words, important words. They do speak the main language, the same main language, but they have their local dialect. So this is actually very important, because when you are trying to educate or trying to share information with those from different communities, you would have to respect their culture, respect their norms, their culture, and basically that would increase the acceptance level, and also that would also incite more excitedness, kind of like feeling amongst them. So that was good. And yeah, this is like by the way activities, like because we were also coming in from vet students, medical students, ecosystem, environmental health students. They were also being able to share their observations of the surroundings and talking about the risks of infectious diseases, emerging infectious diseases within the context of their environments while we are there. Yeah, and we did have some fun. And then because we had one lecturer who is a zoologist and a wildlife expert, so we had the chance of going up to the dry salt lake. This is where elephants would normally come and then get the salt lake part, and then they would come into groups. But we didn't basically came into encounter with any of the elephants, but we did with the dungs, and so you know, we were able to see firsthand of what is actually around, and then how close these are to the indigenous communities village. Okay, so we were discussing about the risks of, you know, apart from the conflict between wild animals and also the humans that lives within the fringe of the area. And then these are all other activities with the younger children's, you know, bringing into arts. Children love to draw. Okay, so that was one activity. And then the second activity was through simulations. So oftentimes when your epidemiology lecturer talks about what do these different teams do whenever they are trying to handle an epidemic, an outbreak within a village, within a state, within your country. And so some of these students were lucky enough to tag along a few of the interministerial simulation programs. So we had different ministries coming together, and then they simulated an event of disease. And usually students are offered to become observers. So you would only observe those staffs or personnel from different ministry doing their work, and then how do they respond to whenever they are in different scenes, basically. So they are also evaluated. And then for the students, they will be observing, and then when they are following and observing and are out in the field, it will actually help a lot in terms of understanding the importance of communicating, especially. And then also we have in situ learning activities with students as well, where we bring the students out into the wild, out into the forest, different settings, so that they are, and then they are being given a triggered with a case to solve a problem that is related to the surroundings. So that is why it's called in situ problem-based learning. Okay. And we've also got One Health Student Clubs. Some of you might be a member of the clubs where your university are, but within our area, usually it's one club per university. And then also mainly it's to plan, to coordinate, organize various activities revolving around human, animal, and also environmental health. And the different activities, I'm pretty sure all of you are already aware of this, and maybe all of you are also doing it. You're also doing a good job at what you are within the subcommittee of One Health right now. And so these are some of the other communities apart from your peers. You can also approach school children, marginalized or at-risk communities, and also members of the general public to spread the awareness about One Health. And then there's so many days that comes in line with One Health. You have World Rabies Day, World Zoonosis Day, One Health Day. So in conjunction with these days, it's really good for activities to be done on social media, or it can be spread. It can spread more awareness to those who are following your accounts, for example. And of course, by participating in these activities, not only you are networking with other students from your university, from other universities in your countries, but as we all know, like it's at global level, so you'll be able to establish network as you already are right now within your association. And other efforts that in terms of empowering future One Health workforce. So this is an example of training and simulation for community outreach program that the One Health Student Club at University Putra Malaysia, they have done this in 2017 and 2018. So it basically is also the first two phases was lectures, was workshop, training the trainers. So we train the students, the university students, in the first and second phase, and then for the next phase, the students who are now called the trainers would then go to the communities, to the schools, to then teach the school children. So that's why it's called the training of trainers, and so it comes in layers. The thing is that these kind of program, it takes a while to plan and also to execute. But once it is done, it's very structured, and you do know which One Health core competencies that you are able to inject into those, and then you will be able to effectively transfer your knowledge to the school children. And then also when it comes about community, so these student clubs, they organize the rabies run in conjunction with World Rabies Day. So it was one of the activities that they were able to organize just before COVID-19 happened. And then this was more to target the students from other than One Health courses, and also to the public, members of the public. And One Health Career Talks, so many different of webinars and talks that you are able to organize, to help again spread the awareness about One Health. And then maybe some of you are aware of this at the regional level as well. Students competition were held, and then for example, this one was from last year, where it's just a video competition, and then we wanted to see multidisciplinary teams from among different students to submit a video that can come under these either three topics. And then, so I mean, with a competition, it's not just a matter of going in, competing, and then winning, but it goes beyond that. What we would expect is that it will be able to help you establish connection with the future One Health leaders, because usually those who evaluate those videos can come from experts, from ministries even. So this can help increase your visibility. Later on, when you are going into the working world, if you happen to work with these people, they would go like, oh, hey, I saw your video, you participate in this. And then that kind of like gives like a good impression, first impression. And then of course, you'll be able to showcase your products and talents. And importantly, I would say to bridge the pre and in-service One Health workforce. Because imagine right now, I mean, I'm imagining I am a student. I mean, there's going to be many barriers for me to voice out my opinions, to have a say, to reach out to those who are already in service. There's no way that I can just simply say that as a student, oh hey, those who are working in this department should do like this and this. I mean, but through these competitions, you'll be able to voice out, but in a creative way, in a sort of like subtle way, so that those who are already in service would be able to like think outside of the box, instead of just following their norms of like working within their own department, ministry, and of course like very less often going down to the ground, up to the level of students at the universities. So these kind of activities would increase your visibility, would transmit your voice as the younger future generation of One Health workforce to those who are already in power. And yeah, again, just sharing testimonial from a student. So it's like refining his social networking and interpersonal skill, which is, of course, it's not really spelled out as one of the course maybe in your transcript later on, but it's embedded through these kind of like different One Health training programs. Again, from Siti Balkis, she was able to gain opportunities, creating a global multi-diverse network with different peoples of various background and expertise, and so can be applied for a better community approach throughout their studies and for a lifetime as they graduate and navigate through the career world. Okay. So throughout running those activities, what I've observed is that, of course, when you have a plan, challenges may come. And it may happen because of conflict in schedules. In different courses, they may have different semester arrangement. For example, those in medical school might have their own special semester as compared to the rest of those other students. And so it becomes one of the barrier. Okay, and communication with students from different courses as well. You may not be speaking the same, be in the same frequency with those because you don't know them too well as from your course mates, so that can be some of the challenges. But looking at the bright side, this can also be one of the opportunity for you to understand them, for you to get to know them. And then, it will be interesting to speak to somebody who is not a vet student and then like come together and talk about a general topic that both of you can relate to. And then from there, you can actually learn a whole lot of things. So for example, from the training that I mentioned just now in the indigenous community, we had a few students from the educational background and also engineering background. So we were talking about how do we, what kind of like thing that the engineering student can contribute, can do when we were talking about zoonotic emerging diseases. And then they were talking about, probably like in terms of building structures that would be more sustainable to the communities, that it was safe for the communities living within the fringe of the forest. And then they were beginning to talk like, oh yeah, so the water should flow like from here and so and so, and then like do those kind of conversations. It really like casually, unknowingly, like you would go like, oh yeah, that's great, and then it's this kind of thing that we would want to sort of like sprinkle to the students whenever like you are out there. It's not just a matter of running programs according to the different objectives, but it's also these sort of like very casual kind of like conversations that's happening that might be more effective. So One Health approach, oops, a typo over there, sorry. So expectation versus reality. So yeah, you have been empowered, in lecture, in the lecture hall by theory, and also in through different trainings, webinars, workshops. Is it really happening in the real world out there when you're working? So yes, it's not a perfect world. Ideally, you would want people to be able to be talking together nicely between people from different departments. The medical fields would be talking nicely to the veterinarians. They would be sharing data, sharing resources. But truth to be told, it's not as simple as that. It's not as ideal as it is, as to what I have observed by sitting in different meetings with, as an observer. Sometimes I feel like I am watching a tennis match because I'm like, oh, okay, one ministry staff is over here, and I know they pass the argument to the next one, and then it just goes back and forth, and it's never ending. And it's not from just that one particular meeting; it's repetitive. I can actually see the pattern as I kind of like attend those kind of meetings, and I'm like, oh my god, this is really, maybe this is actually the effect of One Health not being introduced when those OGs are studying. Are doing the degrees. It's actually one of the things that I kind of like trying to like, come to a point where I'm trying to prove my hypothesis over here. Whenever I sit, I'm just gonna like do like a, count like how many arguments, and like even though those individuals were also faces that I also see or in-service One Health training, Yet, it's very difficult to change their behavior. When it comes to One Health, it's not so much about the technical skills, as in, because they already know it, they're already expert in it, diagnosing diseases, trying to come up with control preventive measures. That's just like that to them. But when it comes to behavior change, that is one of the biggest barrier that I see. And it's in terms of sharing data, in terms of being open to people coming into their premise to work together, to borrow some stuff, that kind of thing. It's still happening. It is happening. Okay. And that is why we have all of these One Health training start at young, at least start at the university stage. At least you guys are all familiar with One Health, and you know the advantage, the benefits of working in One Health. And so we are hoping that in the next 10 years to come, at least, we are able to see the newer generation filling in the gaps of the OGs who are already like leaving the working world. And of course, it's not, I mean, this is not like a blaming kind of like thing whereby you have the older generations against the younger generations or vice versa, but it's actually we have to adapt. We have to be flexible to whatever that is required right now. And if that requirement is to be open to those from other fields, then, why not? So this is actually still a work in progress for those in service, but hopefully it's something that all of you will be already be equipped with when you enter the working world. Okay. And then just one more aspect of One Health is that in terms of communication. So oftentimes we see people communicating technical jargons on news interviews, interviews. So those who are like, for example, our parents would be able, are they able to like truly grasp all the message that they are trying to say? So we need those from the communication background to effectively help deliver the message. So we have to be open to them, no matter how silly it may be. Like, oh, you use colors, you use toys to illustrate it, and people would go like, oh, that is silly. And some people would say that, but it's actually more effective, as you can see here. It's like trying to explain, the severity of COVID-19 in vaccinated versus unvaccinated population, and people can easily see, what happens between these two different groups in terms of the disease severity. So communication and behavior change is really important. Okay, so actually it's your time to take over the world and then make it a better place. We are facing more and more challenges in terms of climate change, in terms of various things that are happening around. But I'm pretty sure that all of you are already equipped with the necessary skills, and we have One Health enthusiasts all around today. So hopefully this will be able to make it a better world. And lastly is that whenever you are faced with challenges, always remember that it's not just the technical, the brain parts, but also bring some heart to it. And then also, of course, work together, bring in your team. Even the Avengers is also a team. You've got Hulk, you've got Captain America, even though he doesn't have power, but he's got the power to bring them together. So everybody needs somebody else to help them to be working together. So we are all superheroes, but the key to success is collaboration. And with that, I end my sharing session. So this is my contact details for further information, or if you've got any questions. So yeah, thank you so much.
Thank you so much, Dr. Nur. That was a very, am I audible? Thank you so much. That was a very, very interesting and wonderful presentation. I enjoyed every bit of it. And I'm sure everybody that is here today also learned so much. If anyone has any question, you can leave them in the chat box. And I would ask mine while we wait for anybody that has any questions to type theirs in the chat box as well. Okay, so during your presentation, you mentioned how like sometimes it may be a bit kind of like difficult to reach the people at the top when it comes to discussing issues. What do you suggest are kind of like ways or things that can be done to get to them and make them interested? It feels like, let's say, climate change now is like a serious problem, but I'm very sure the president in my own country has no interest whatever in climate change at all. So what are some of the things that you think we could or anyone could actually do to reduce the distance and yeah.
Yeah, Mariam, that is actually a good question, and it's not just in your country; it's actually in my country as well. Truth to be told, um, really, it gets really annoying, because at times they are all adults. So they are all adults. They are grown ups. So why cannot they those in power take it seriously? So this is why I think it's happening all around the world. We really have that kind of like rebellious kind of feeling like every time we read social media posting by certain people of prominent position, they would be blurting out things that doesn't make sense, and it goes the opposite way around of what we would expect them to be when they are in that position. So I think we in terms of the limited power or powerless position that we are right now in terms of political aspect of that, I think one way is to make a good sort of like impression, or because influence, sometimes networking is very important. If you kind of like know somebody who is in a position, so usually these political people or those who are in position, they rely heavily to the advisors around them. And but the thing is that sometimes their advisors are also the same as them. So if you happen to like be able to get into wiggle your way through and then kind of like tag from one person to the other, and then of course some of them would, I mean, it will be really really an ideal, not ideal situation if all of them would not be caring at all, but at least you can target one, and then you'd be able to wiggle through that kind of like network. That would be great as well. um, apart from using our power to vote, but that kind of goes way. So that's why, I mean, I think when we are talking about political issues, sometimes people don't like it, but it actually affects the way our country is, the policies. They are the policymakers, so we have to use our voice, as young me, young as well, so in this population, so we really have to sort of like start somewhere, either through voicing out through NGOs, different groups. When you are together with those groups that can make your voice heard, that would be really great. But yeah, it is challenging. Yeah.
All right, thank you so much. Sorry, excuse me. All right, thank you so much. That was a very good reply, and I do agree that I guess if one is able to kind of like get to the advisors of all these people, there's a greater possibility of a change being made and all. I also have another question that says, so I noticed that you were able to kind of like do some outreach programs, and outreach programs are kind of like very great in getting the message to the communities. But however, I think one of the challenges people do face is like funding. So the how do you think anybody that wants to kind of like hold an outreach program can like go about getting funds? Or are there like organizations that support One Health programs and would be willing to fund stuff like that?
Yeah, so it's about funding. Yes, this is also another barriers as well, because we have ideas out there. You've got so many students coming up with ideas. Hey, doctor, do you want to do this? Let's do this. But yes, again, funding is another challenge. Okay, so so I'm not particularly sure of how things work in other countries, but we over here sometimes the university do fund for activities. However, it's not much. It really isn't like it really isn't 10% of the total cost. So at times we do have students who are willing to pay for accommodation and travel because they really would want to. But by doing that, kind of like it's a bit unfair to those who cannot afford that. So the experience is not fair to all. So that I think it still is also another issue, but I think keep your eyes close to announcements by different One Health bodies because they do fund some activities, but it's really again it's not widely offered. They're quite selective at times. It's a bit difficult to get, but yeah, I think also sometimes uh, companies they do have these CSR activities. So if you happen to be talking to somebody who works with a soap company, preventive, because I know some of the students, they did this before. They were speaking to somebody from this company, and then they were like, these company were wanting to offer, to pitch in a bit of a money for that kind of activity because that kind of like a win-win situation. The students get the funding while these companies get, exempted from tax and also from CSR, corporate social responsibility activity. So that's one of the way. Some do crowdfunding, but it's not really, sometimes it's not really a lot of chances. So yeah, I acknowledge that that is also another barrier. Yeah, there's no one easy answer for that. Yeah. Mm.
Okay, thank you so much. I'm sure everyone listening would pick one or two things from there.
Yeah.
Then I had one more question that I just thought of now. So for students that would like to kind of like venture into let's say public health, and I think some universities are kind of like offering masters in all these One Health programs nowadays, like open graduation. Can you maybe help us out to like some places where they can work?
Where they can
So
work
how,
placements.
yeah, yeah, like employment opportunities available.
Okay.
Do you
So
get the question?
these are like, is it for industrial training placements or is it like later on in career? Sorry.
Yes, like what I mean is like for you now, you did I think masters in
Mm,
epidemiology,
yeah.
right? So let's say somebody else wants to kind of like do masters in epidemiology or masters in One Health. After completing the master's program, what are some places in which the person can work?
Mm,
Like,
okay. Yeah. So I think there's plenty of institutes, especially that are that want the graduates coming out from the masters in One Health, for example, because as you can see, when people are talking about those who are writing policy, ministerial people, they find really they attracted to those who have certification related to public health policy or One Health. The USAID also at the same time they are launching the One Health Workforce Academy. So there's two chapters. One is within the for the Africa chapter, AfroHun, and one is with the Siahun chapter. So on their website, I think it's still a bit like under progress, but in the next few years to come, it should be established. And then on that website, not only opportunities on courses, trainings, but they might also be posting on career opportunities, for those in One Health. So I think if you are able to follow like the USAID page, the One Health Universal Network page, they would do at times, from time to time, that kind of announcement. And so, yeah, after masters, I mean, you can also even go into the academic line to become a lecturer if you want to. So that kind of like it all depends back to your passion. If you're wanting to if you like to talk to people, if you like to write papers like policy papers, then it's good for you to go into the government part. But if you like to do research teaching, then you can go into the academic line. But it's not just limited to that. I think many institutes around the world, you can actually go and work outside of your country as well. I mean, I think it really adds that kind of like extra points to your CV if you have that kind of like certification nowadays.
All right. Thank you so much. And we have some questions in the chat. I'll try to read them now.
Okay.
So someone asked that, how do we even start to try to change others' behavior and ignorance? And how do we mitigate it? And he also said, do you feel helpless sometimes trying to advocate for one health?
Okay. So the first question, thank you. It's an interesting question. So the first one is like, that's why we need those from social sciences, behavioral expertise. So we need to have them, to bring them to be part of the team, because as what I have observed is from my observation, but I cannot say anything beyond that, because for nowadays especially, people would want things to be scientifically evidence proven, before you are able to say something. And so with that, I would need somebody from the humanities. They are the ones that we need to tag along and then say that this is how we tackle, this is how we try to change behavior, because it can't happen in just like that. Some people say that it's good to impose like a law kind of thing. They like the harsher punishment kind of thing. But at the same time, you also have people who say that no, if you do that, then it wouldn't be effective. People do it just because they are afraid of certain laws. They're afraid of going to the jail. So this is why we need expertise from the social sciences field. And the second question was, what was it again? Sorry, I forgot about it. The second question was, uh,
1 minute. Okay. Do you feel helpless sometimes trying to advocate for one health?
So it's okay. So helpless, as in sometimes at the moment, like I mean, to certain groups, but obviously it's not the students. With the students, I feel very much optimistic. It's only with the challenge. The main challenge is more like with the in-service, the older generation, original gangster kind of like group, as compared to you guys. So all of you are like I really enjoy. So there's no point of me feeling hopeless to the younger generations. It's like you guys are full of energy. I have full trust in all of you.
Oh, thank you. Okay, somebody said, is it also possible to join those activities even from outside Southeast Asia? I think you mentioned something about a competition.
About the competition,
And I think, is it
yeah,
possible to participate outside Southeast Asia?
yeah.
I hope I got it.
Some of those activities are are limited to just within the region, but that was because of that was organized by the Southeast Asia One Health University Network. But I do know that, for example, Dr. Deborah Thompson of One Health Lessons, she and there's a whole lot of like One Health Commission. They do run a lot of other activities that you can join as well. So yeah, unfortunately, some activities are limited to certain regions because of the eligibility part. Yeah. But yeah, it would be great if it's open to the rest part of the world. Yeah.
All right, thank you. I think that's the last question. Let me just check and confirm. Sorry, just 1 second, please.
So,
Okay, great. So I don't see any other questions. And thank you so much. It's been a very interactive and enlightening session. We'll be drawing the curtain at this point, and I would encourage the people that are here to join us back at 17 UTC for the second session with Dr. Ahmad. Thank you so much for sparing us your time today. And yeah, Anisha, I don't know if you have anything you want to add.
All right. Thank you very much, Dr. Nur, for receiving our invitations. We are very glad to have you here, and we hope to have more collaborations in the future. Thank you,
Yeah.
Doctor.
thank you so much for having me. Take care, everyone.
Take care, Doctor. See you.
See you. Bye. All the best for your exams.
Thank you.
Bye.
Bye.
All right, guys. So we would love to see you in the second sessions that will be in 5 p.m. UTC. See you guys.